I think we're missing Mike. See if he's available. Well, we'll, let's see, I'm just trying to get my view to adjust. Okay. View adjusted. Excellent. In that case, I would like to call the meeting of Board of Health to order. We have a relatively abbreviated agenda for tonight. Try to make good use of people's time. But I'd first just like to announce that tonight's meeting is being held virtually in accordance with Governor Baker's emergency order due to the global pandemic. It's approved to hold the meetings virtually as long as you can converse with the majority of the members of the board and that reasonable public access and notice is provided. In this case, we have both a call-in line and a video line that can be used for public access. At various points in tonight's meeting, we may be open to public input. At some point I will call on Cheryl to let me know who's the moderator, whether or not anyone wishes to make public input, and we'll see if that's appropriate to accept it at that time. And I think that covers the opening remarks. So we have a first item of agenda on the agenda for tonight is to update the guidance from the Board of Health as well as our policies and orders to be consistent with the orders from the state, which came out this past Monday, May 18. And with Cheryl's preparation and Mark's tender care for correct parsing and ordering and structure, I believe we have a update which we can use to amend our previous policies and orders to make them consistent. So Cheryl, I'll turn to you to just sort of introduce the topic and then see if the board is prepared to move on it.
So
Cheryl,
we're looking for 3 votes for tonight.
Your faces.
Yeah, can you not hear me?
Now we
can't
can.
hear me?
No, we can hear you.
Sorry.
Yes,
so we have 3, what's that? Maybe I should
Dr.
call
Bill
in on my
just
phone.
saying he could hear you. We're doing okay.
All right, so we have 3 votes that we need this evening. One is on the public buildings closure order that the board had done, and that was we did that on 3/16/20. The other one is on the Board of Health closure of business that we did on 3/19, and the other the narrow park closure that we did on 4/6. So what you have in front of you tonight is 3 votes. And as Bill mentioned, I worked with Mark to get the language right. One thing I do want to say prior to voting these, if you're inclined, is, I think it's important that the public know that even though the board may vote to these new orders tonight or these modifications, like Nara Park, for example, I talked to the rec director today. She has indicated that she may need some time to come into compliance with the protocols that the governor's put in place. So even if the board, votes for these this evening, it may be a period of time that the town needs to get procedures in place to be able to follow the governor's guidelines. And, same with hairdressers. I've had a few phone calls from some hairdressers that they're not quite ready to open because they can't meet the guidance. So I just thought it was important to mention that before you guys get started.
Okay, I think that's quite reasonable. I think our amending the orders is permissive but not required. In other words, it allows the hairdressers to open, but it certainly doesn't require that they do that. And I actually just have a question. As I read this, it looked to me like this could be done as a single motion. Mark, was that your intention, or did you intend it to be broken into 3?
I would suggest we break them up into three different ones because they're three different items. One is public buildings, and that was important because it's effective on Monday. The next one for elective personal care was partially allowing things, and of course, that's noted to be with the requirements and restrictions of this governor's order. So it may open if they meet all those requirements, subject to a whole bunch of different things. And the last is to do with NARA separately, since that's a separate item within the town control. So I would suggest we just do them, 1, 2, 3. I think the easiest one is the first one.
Okay, well, since you're, very familiar with these, would you be entertain making a motion to approve the first one?
I would, but before I do that, I guess I would suggest, see if there's any comments before we make that motion.
Okay, typically, Mark, what I do is once there is going to be a motion, that's when I would ask if there's public comment so that it would help to inform board members before they vote. If there's not going to be a vote, then typically I wouldn't, that there isn't a need for public comment. But if you prefer to take it first, we can do that.
Since I work with Cheryl, to try to get this straightened away because of the emergency situation, I would just ask that there be some other comment, other people make the motion, just so it's appropriate and it's flooded and transparent.
Okay, very good. Cheryl, do you have anyone that appears to wish to make a comment on the first paragraph of the order modifications?
No, I don't see any hand raised.
Okay, Dr. Taylor, I see you've unmuted. Do you have a comment?
I have a question for Mark. Is it wise to put in, requirements, safety standards, and restrictions, what they are? Because they're probably all different in those three, aren't they?
Absolutely. In the public buildings, it depends on whether it's an office or other types of public buildings. So that's why, it's, that's why it was written that way, because it's really challenging the way this has been done in a phased approach with different buildings. And indeed, there are even the same types of buildings have different schedules in different areas of the Commonwealth. So
Yes.
that's why it was a challenge to try to write it clearly to make sure you're consistent with the state order and the associated guidance, requirements, and restrictions. So kind of a hard answer, but that's why I tried to word it that way.
I was just wondering, in terms of the statement, couldn't it define those based on what the order was in 518?
It's multiple pages. You have to do a whole bunch of certifications, and you have to have a plan. It's a lot more involved when you start getting into it.
All right.
The employer has to do certain activities of monitoring, logging, cleaning, certifications. It's very intrusive and time consuming, but very important. So I think that in some of those things are guidelines which are changing. So I was trying to write it such that we're saying we're following the state guidelines, requirements, restrictions, and order.
Okay. I think that's a good reply. Thank you.
Any other questions or comments from members of the board? Which would pretty much come down to you, Joanne. If that's, you're all set. And also, I'm sorry, Dr. Singh or Dr. Jacoby.
Yeah, no, I'm all set. Thank you.
All right.
I'm all set too. Thank you.
I'm good.
Thank you. Actually, I apologize. I missed one housekeeping order. As it appears Mr. Cruz is not going to make tonight's meeting, then one of the associates should vote in his place. If my memory is correct, Dr. Singh was the alternate last time, so I believe that means it's Dr. Jacoby's turn. Does that sound right, Dr. Singh and Dr. Jacoby?
That's fine with me.
Okay, I'm good with that. I'm good with that.
All right. Then in that case, Cheryl, just please note that Dr. Jacoby will be voting in place of Mr. Cruz tonight. And that's, I believe, perfectly appropriate because Dr. Jacoby has made every one of our meetings so far, so he's aware of all the issues. Okay, Mr. Conaby, would you be comfortable making a motion at this point?
I was gonna hope that someone else would make the motion. That's why I thought I had mentioned before.
Oh, sorry.
Yeah, I would go ahead and make a motion that we approve each of these pertaining to the public building closure, the elective personal care business order, as well as Nara Park. And we approve them to be consistent with the order of the governor dated 5/18/20.
So, Dr. Bill, could I just ask you to do those one at a time? So could we do the first one, and then I'll certainly, if you wish to do motion the second one, that would be great. But
Okay, that's fine.
I'd like to just,
So the motion then is to approve or to amend the public building closure order to make it consistent with the requirements, standards, and restrictions of the new Massachusetts order dated May 18, effective
good. Is
May
there-
25.
is there a second?
I'll second it.
Thank you, Joanne. Motion is made and seconded. Is there further discussion? Any comments from members of the public, Cheryl?
Sorry. I do not see any.
Very good. In that case, all members, please vote. I'll take a roll call. Dr. Taylor is here at the top of my screen.
I'd say aye.
Dr. Jacoby.
I vote yes.
Thank you. Mr. Conaby.
Aye.
And Ms. Becerra.
Aye.
And I also vote aye, so motion carries unanimously. Dr. Taylor, if you'd like to keep, if you're on a roll, please feel free to go ahead with the second one.
All right, I'll make a motion regarding the elective personal care business order, that it be updated, adopted, incorporating the requirements, standards, and restrictions of the Commonwealth Order May 18th, effective May 25th.
Very good. Is there a second?
I'll second.
I'll second it.
Very good. By about 1 second, I think, by 1 second, Dr. Jacoby was the second. Very good. We have a motion made and seconded. Is there any public comment, Cheryl?
No.
Very good. In that case, I'll go from the bottom of the screen to the top. Ms. Becerra, how do you vote?
Aye.
Mr. Conaby?
Aye.
Dr. Jacoby?
Aye.
And Dr. Taylor?
Aye.
And I also vote aye. Motion carries unanimously. And making this a sweep, Dr. Taylor, you could go for the third.
Bill, can I interject for 1 second? There
Of
seems
course.
to be a question that Cheryl raised in the beginning about the ability to implement the opening partially of the park. Is it regarding the walking, the sports, or the restrooms that are concerned? Because we can change the effective date because it's all within the control of the town. So I just want to make sure we're not putting some sort of burden. This was the earliest it could be done.
Yeah, I would assume, Mark, reading your, what you wrote, this, like I say, this would allow the town to do it. It wouldn't require that the town do it. Obviously, it would be up to the staff to determine if they have the resources or abilities. I would assume. Do you read it differently than that?
I just want to be clear. I think as long as it is worded that way in the motion that the Board of Health amends its order and may only reopen the facilities, I think that would be fine.
Okay. Well, I think then, Dr. Taylor, as long as you may include in the motion that it may be opened, then we probably could proceed.
Does that mean we'll need another vote in the next meeting?
I hope not, but unless, of course, the state issues new guidance again.
All right, so I would make the motion that the public order for Narra Park, the effective date is recommended to include the ability of the town to be able to prepare the park to meet some of the restrictions and the activities that will be allowed in the park.
Okay, thank you.
And to
Mr.
be
Conoby,
consistent with the Massachusetts order of May 18th.
Very good. I just asked Mr. Conoby, do you think that was conclusive enough, or do we need
As long as Cheryl has it, I think it's pretty clear. I mean, that is what he's saying is the park may reopen according to this order when they're able. Is that correct, Bill?
Yes,
Excellent.
yes.
Would you feel comfortable seconding the motion, Mr. Conoby, since you happen to be on the mic?
Yeah, I'm fine with it. I mean, I think that we need to, be clear what we're suggesting, that it's only transitory activities and non-contact sports among individuals from the same household. It's very critical that people understand that this isn't groups, this isn't congregating, and that all the other requirements like face covering and social distancing are appropriate. And the town can, on its own volition, close the park if it's not able to enforce it or if it's a hazard or other problems. So based on that, I just want to be perfectly clear that I'm fine seconding what was ordered here, so to allow the town that flexibility in compliance with the new governor's order.
Great. Thank you very much. Motion is made and seconded. Cheryl, I'll ask, is there any comments from members of the public?
So there was just one thing in the chat asking if this pertains to other fields in town, which I was intending to bring up in the next agenda item, if that's okay, unless you want to talk about it now.
No, I think it's probably reasonable to talk about it because to my reading, does it, unfortunately, the way Zoom has it, I have half the thing covered, but it appears it's any town park, although
No, it's near.
it says the park. Yeah, it's just
The order is only as written
Yeah,
for Narrow Park because there are other fields that could be reopened, but they would only be allowed for certain activities. And considering all the situations, particularly the spike in the number of cases, the doubling of deaths this week, I think as they're saying, a partial slow rollout's appropriate rather than
Yes.
just. So that was my thought. And the issue is that we've been requested by a number of folks to consider opening NARA. This allows us to open it. It was closed by my understanding of the governor's order anyways. So this would be an allowance in line with the governor's order.
okay. That's fine. And I just moved my my screen a little bit so I could read it. And you're absolutely correct. So Cheryl, you're right. We should. This pertains just to NARA, and the motion has been made and seconded. And so in that case, I'll ask if any further comments from members of the board.
Yeah, I have a couple of comments. Number one, would this also open up the parking area? Can we make sure that it will also open up the parking area? And number two is
It doesn't, but I believe we intend to address that later during Cheryl's update.
Correct.
okay. I just have another comment that may be helpful. I saw a picture in the paper yesterday of a park in Brooklyn, I think, where they drew these big circles on the lawn, 6 or 8 or 10 feet apart. So you could have some groups, family groups, and they could fit in these circles and yet be 10 feet apart from the other circle. Just a suggestion.
Yeah, that's a good idea. Okay, well, if there's no other comments, then we'll vote. So starting the different direction this time, Dr. Taylor, how do you vote?
I vote aye.
Dr. Jacoby,
I vote aye.
Mr. Conaby,
Aye.
and Ms. Becerra.
Aye.
I also vote aye, so the motion carries unanimously. Very good. That moves us on to the next item on the agenda. Cheryl, would you mind introducing this topic?
If I had the agenda, can you put it, there you go, thank you. So the next one we have is other updates. So NARA specifically, we needed a vote specifically for NARA because the board had voted a NARA order of closure. The board, has recommended that we reduce parking to the other areas. Recommended one way, to help. So, social distancing so people aren't passing. So we didn't include the modifications to those other, and the athletic fields. So we didn't include those modifications in the vote because you never did an order. So what I'm seeing, according to the state Executive Office of Energy and Environmental Affairs, it talks to guidelines for parks, open space, and outdoor education programs. It doesn't specifically say athletic fields, so if the board's inclined to go slowly on that, that's fine with me. Actually, it does. It says athletic fields and athletic courts can be utilized only for non-contact sport with no shared equipment such as tennis and pickleball. No permits should be issued for group gatherings, and users should not engage in pickup games, organized games, or tournaments. And then there's guidelines, that anything has to be sanitized. When engaged in play, you can't touch each other. There's users wanting to use another piece of the field have to wait until the other is vacated. And users should not engage in pickup games, organized games, or tournaments. So it's pretty clear, that guidance is pretty clear that, the health division can just implement that, or you guys can consider voting it. But I ultimately would like a discussion on allowing back open the parking for the Arboretum, the rail trails, and NARA.
Okay, very good. I heard if maybe we sort of take those one at a time because they might be slightly different cases, but I heard a suggestion from one member that perhaps for NARA it makes sense to open the lower parking lot fully and leave the upper parking lot closed. And I guess you're absolutely correct, Cheryl. The way we did it was a recommendation to the selectmen, and the selectmen implemented the parking restrictions, or perhaps they just endorsed the Board of Health's requirement in a manner to the town staff so that the town staff did it. But regardless, I think then we should take the same form and recommend to the selectmen that the parking restrictions be modified or approved if that's the board's decision. So opening that discussion, I think Dr. Jacoby is in favor of removing the parking restrictions.
Yes, I am.
Could I ask, Mr. Conaby? I know you're close to the park in where you work. How do you think that might be able to be implemented?
That's really a question for the police. I mean, as they did some of the limitations, there was a lot of problems. They really couldn't police it. There's been a lot of non-compliance in the upper fields. I think we should go slowly. I mean, this is only phase 1, part 1. So, that's a big park. You're only transitory, and it's only for limited activities amongst the same family or household group. So, I think it would make more sense to have the situation where it's the lower fields, so they're only patrolling one area. It's easier for the police and the recreation department to do it. Start that way. We're going to be meeting in another week, see how it goes, and open it in phases. The Arboretum has certainly been, we've been told, very good compliance. That seems prudent. The rail trail has had a lot of problems where people just knock it down anyways. So I guess probably won't make any difference if it's lifted because they're not obeying it anyways. So I think you really need to look at situation, but we do certainly want compliance, and the issue is really to try to minimize the amount of contacts to minimize the risk. So I guess my point is, it seems reasonable based on this reopening to open the lots at the Arboretum and the rail trail, and the lower lot at Nara proceed slowly and see how it goes. There was already concerns at Nara about the rec department opening it. So they may reopen it, and I think they should be opening the parking lots as they reopen the park. Just make sure they're concurrent.
Okay, very good. Dr. Taylor, do you have an opinion that you wish to share, or you all set?
Well, I'm in favor of opening it, but other than that, I have no specifics.
All right. And Ms. Becerra or Dr. Singh, either wish to comment?
I'm in favor of reopening there, and I think it's, if I'm reading the order correctly from the state, it does allow for other activities than just walking. So, Mark, when you mentioned transitory activities, I think it's also, if, two people from the same family want to toss a frisbee around or something, it sounds like that would be allowed, provided that at least 6 feet of social distancing between groups and all the other precautions are followed. So I just want to make sure that that's what we're approving. And I have no comment about the parking. I think people are going to come no matter what. And if they're not following restrictions now, then they're not going to continue to follow them. But
Okay.
anyway.
Well, if I could just ask them, Joanne, since you're, sharing your opinion, it seems that we have general agreement to open the rail trail and Arboretum, or recommend that they be open. And that NARA, there's only one point of I'll say discussion, which is whether we open just the lower parking lot or both the upper and lower. Do you have a preference on that, or an opinion, or you're relatively agnostic?
I would open up all the parking at Nara if we're going to open up the park. I don't know, public safety. There might be some people who just want to go to the upper area and toss a frisbee around on the grass, and they don't need to be in the lower parking lot. So it just reduce congestion. But I don't feel passionate about it. If we're going to open it, we should open it.
Okay. Dr. Taylor, do you have an opinion on the distinction between upper and lower?
No, I tend to agree that if we're going to open it, we should open it, including the parking.
Okay. And Dr. Jacoby?
Yes, I agree. Open up the parking, upper, lower, and rail trails and Arboretum.
Okay. So I believe we had made it as a recommendation to the selectmen previously. Mr. Martin, since I happen to see that you're online, do you agree that a recommendation from the Board of Health would be helpful to the selectmen to, modify the parking restrictions?
Yes, I think that would be helpful. And I think we, want your recommendation for making a change.
Okay. So, Mr. Conaby, that there's a slight divergence among the board. I don't know if you would be willing to accept full opening of NARA, or it's still.
I'm very concerned. I mean, on my way home, I drove past it. Cars were trying to park there. People were on the field and people were running around it. I mean, I don't think we should be allowing that. I mean, it says non-contact among same family members. People were out playing soccer. That's not an allowed activity. Throwing catch, they say a ball. Person with frisbees is similar. The guidance is pretty difficult, and it's a little bit more remote, a lot more difficult to manage. it makes it more convenient, but I think we need to be cognizant that we're trying to reduce the risk. We've had a lot of problems. It seems like starting slowly is a better approach. Let's try it for a week, see how it goes, open the rest of it, do it stepwise and carefully. It's up to the selectmen to make that decision, but they're also going to have to get the input of the rec department and police department to make sure it can be enforced. Because if it can't be enforced, the park would have to be closed. And that would be a very bad situation where it's really needed as we're opening.
Okay, I see Mr. Martin wishes to add something.
So I was just going to suggest that, you might want to include those guidelines that Mark just mentioned, or the things that he was concerned about in the recommendation, and possibly the Board of Selectmen could, ask the Recreation Department and the Health Department to manage the parking as they see fit in order to meet those guidelines. Just a suggestion.
I think if you add the police department on the enforcement as well, that seems like a very prudent suggestion.
Very good. So at this point, perhaps we're prepared to move forward. I don't know if anyone would care to make a motion or feels confident enough to make a motion.
Do we need to make a motion, Bill, because we didn't, I don't believe, make an order to close it?
No, we didn't, but I believe we did have a recorded vote to the recommendation to the selectmen as a joint motion. At least that's my memory. I don't know if Cheryl, if you have any different historical perspective.
When I went through the orders and all the minutes for the last meeting, I didn't pull that one because it clearly wasn't a vote. It was more of a, this is our recommendation to the board of selectmen.
Okay. Well, then in that case, let me just do it as a sense of the board so that Mr. Martin can say that there was, sorry, getting tongue-tied. I'll go through the order. Dr. Taylor, I believe I understand your position, but would you mind just stating that you're in favor of removing parking restrictions and any conditions?
I don't object to what Mark added in terms of some kind of enforcement. I think the spirit now is trying to open up and loosen some restrictions. And if that doesn't work out, or if cases surge, there'll be possibly a different decision. But I hate to restrict, go part way in sort of opening it up. And if someone could enforce that, I think that would address the increased freedom.
Thank you. Dr. Jacoby, do you have any comments you wish to add?
Well, I think it's just what I said before. I believe in opening the parking upper and lower. If people are playing soccer or anything else that might not be acceptable, I don't think having up a lot shut is going to effectively make a difference. It's going to be what it's going to be.
Okay.
We have to enforce the regulations. We have to make sure that the public understands, and hopefully that they will act responsibly.
Thank you. Mark, just to ask, I think we understood what you said, but would you like to add anything, or are you all set?
I think Dr. Bill explained a lot of it, and I think going stepwise and based on enforcement. But limiting the parking did limit the number of individuals and reduce the non-compliance. So they're directly related. So I think it's an important consideration. And I think, as Dr. Bill pointed out, if the cases surge, we have other issues, it'll be revisited. So I think it's a tentative plan. And a lot of other communities have had problems where they've opened up things and then had disastrous consequences, and they've had to reclose it. So I want to make sure that we can properly manage it, enforce it, and as you start getting to the upper lot, which is more remote, that becomes more of a concern. So I'll leave that at the discretion, but I think my suggestion would be to reopen it slowly as appropriate, being monitored, subject to change.
Okay, thank you. And Ms. Becerra, would you care to just offer comments for the selectmen?
Sure. So I would still be in favor of opening both lots, but with the added caveat that the recreation department and the police department, the health department feel confident that things can be managed. So, if the rec department needs, some additional time to set up protocols or, signs or however they want to ensure that folks are using the facilities in the appropriate manner, that's fine. That's sort of the caveat overall. But I sort of agree with what Dr. Jacoby said is, they're going to come no matter what. And I think having fewer parking restrictions aids in public safety. People parking along the side of the road, the parking lot would be, maybe less crowded or less congested.
Okay, very good. Thank you. Mr. Martin, hopefully that gives you a reasonable sense of the board. I would just add, I believe the sense of the board is, and I would agree with, is to start relaxing the parking restrictions as appropriate. That makes sense. In consultation with the recreation department and the police department and the health department. So if you wouldn't mind bringing that to your fellow select people, that would be helpful. I would also just add, we've just been discussing the parking, not any of the other things related to the use of the town facilities, such as, wearing a mask and one-way promenade around the walking paths, things like that. So, do you feel comfortable moving forward, Mr. Martin?
Yes, I mean, I think that the with the details like the one-way path or whatever, I think that the implementation of that's better left to the recreation department.
Mm-hmm. Yes. Just saying, I believe that's still the board's recommendation, that you implement things such as that, wearing,
Yes.
well, there's a mask order from the state anyway, so.
Right, and I understood that the sense that we want to adhere to the governor's order and what activities are allowed in that order.
Right. Thank you. All right. Well, I believe we've covered that topic. Cheryl, are there other updates?
What about the other athletic fields in town? Are we keeping things status quo to see how it goes with NARA, or what should we do?
So when you say athletic fields, this would be things like the baseball diamonds, like at the schools, for instance, or something like that?
So we have a lot of fields. We have, a soccer field. We have, there's one at Robbins Mill. There's, Gardner Field, which is a lot of playground, which obviously have to stay closed. But, if a family wanted to go into that facility and, go for a walk or toss around a Frisbee or do a transitory activity, right now they can't.
So it seems the governor's guidance listed specific activities. It was fairly specific. So like I think it said no basketball, certainly. I think it also, I don't remember what it said about soccer, but there were certain permitted activities, and by implication, anything that wasn't permitted was then not permitted. So I guess where I'm going with this is something like a baseball diamond where it's designed for baseball. I mean, you could have a picnic there, but it's pretty much designed for baseball. And if baseball is not one of the permitted activities, then probably that should remain closed, I would assume. But other areas that could be used for, tossing a Frisbee or like a soccer field, that gets problematic because if there's goals set up for soccer, people will want to play soccer. And I don't remember if soccer is one of the activities that's allowed.
Bill,
Yes, Mark.
So,
I did check with the state specifically looking to see what were allowed permissible recreational activities. And it said only non-contact, such as throwing a ball, the ones that were listed. So the question then came up, what about soccer? No. Basketball? No. What happens when you start getting into things like lacrosse? No. It's like, well, that's similar. And the answer was only the enumerated ones were allowed. And that's where it becomes challenging. And it also is limited to only members of a family or household. So if two kids want to go out and do it, who are unrelated, that's not permissible. And you have to make, only a certain amount on the field, and they have to be enforced. It's a lot of challenging things which will be changing in a couple of weeks. And all of the youth ones are part of phase 2. So, I mean, if a field is designed for baseball, softball, soccer, lacrosse, yes, it could be used for something else, but the problem is those aren't permitted activities. So I think it's going to be a challenge to enforce that. If we have fields which are designed for open space for other things, not specifically designated for a sport, that seems reasonable. I just not sure where that would be.
Well, and Cheryl, unfortunately, it sounds like, I'll ask other members. I think Joanne, you had a comment as well.
yeah. So, athletic fields and non-contact courts can be utilized for non-contact sports with no shared equipment. No organized games, no pickup games, no tournaments. So they specifically talks about tennis and pickleball, which people have their own equipment for that. But again, thinking about the baseball field, if a parent and child want to practice throwing a ball on the field, or do some hitting, or something like that, something that's not organized. Would that, is that something we would allow or not? If it's using the field as it's meant to be used, or two siblings, tossing a lacrosse ball back and forth on a lacrosse field. There's a gray area, because it says no organized games, no pickup games, but can you use the space for potentially what it's designed for, provided there's no shared equipment and all the other parameters. It leaves a lot of gray areas.
Yes, I would say it's mostly gray. Well, let me offer an opinion, and members can see if they are accepting of it. As I think Mark said, and it's also my reading of it as well, it's enumerated activities. Now it gives examples, but it says, playing catch is okay, playing frisbee is okay, playing soccer is not okay. Apparently playing baseball is not okay. And to have a baseball field but say, well, you can do it, but you have to be, brother and sister, I don't know how we can do that. So I'm hoping that the guidance will become less gray, maybe either more black or white, moving forward. So I would suggest, and here's the suggestion part, that we hold off on doing something for this. I mean, we do meet weekly. If the guidance changes, if the situation changes, if the progress of of defeating the disease changes, we can adjust accordingly. But that we hold off for now. Joanne, I see you. Looks like you have a comment.
Oh, I never, I guess, muted myself. No, I was just, where'd you see that, those activities, renewment listed? Because I couldn't find them up on my little searching here.
It appears in a couple different places. That's the where it gets confusing.
So I got the guidelines, but I don't have the, soccer bad, frisbee good list.
I think Cheryl.
What's the story with tennis courts?
So tennis appears to be a phase 2 activity.
Yeah, we got confirmation of that. A couple people called the COVID hotline through the state, the 211 number, and we answered. That call was pretty specifically stated as phase 2.
Well, but you have private tennis clubs functioning.
Not that I'm aware of.
Well, I passed by North Acton Hubble this morning, and the courts were full.
Okay, well, I didn't know.
I didn't imagine it.
We can deal
And
with
it wasn't just family groups. It was, I guess 4 women playing doubles, a couple of men playing singles. I don't know what was happening inside, but the outdoor courts were definitely full and people waiting.
Where was that, Dr. Jacoby? What
Well, in North Acton, it's right by the Sportsman's Club.
Okay. We can address that tomorrow.
So either shut everybody or open up the tennis courts. I mean, I don't think it's fair if you can afford or want to have a membership that you can play, but the general public can't.
Yeah, the guidance from the state is phase 2, which, at the earliest is somewhere the beginning of June. So we'll have to, it's the first I'm hearing of that. So
You should also point out that indoor is phase 3. Outdoor recreation is phase 2. Indoor recreation is phase 3 under their guidance right now.
Joanne,
I don't
you have a
want
comment?
I found a remuneration with phases, and it says tennis courts is phase 1. Has that changed?
So and again, Cheryl or Mark can help me, but as I've read it, it's phase 1 if you're all in the same family. So if you're all in the same household.
Okay.
It's for municipal tennis courts that are allowed to open only, not businesses. It's under the.
That's not what I'm saying. Unless this was updated, it says phase 1, no contact sports, tennis and cash.
Is that the summary or is that the specific guidance document?
Well, I had the specific guidance document open before, and then I did a little more searching, and I now have a color-coded chart with the different phases.
Right,
open.
but it's under municipal public spaces. It has athletic fields and courts, and it says for non-contact sports, tennis, catch, only users from same household. And when you get to that's under that category.
Okay, I see. I was looking under a court, the athletic fields and courts, which was in a
right,
different
and those
place.
are under phase
Got
2. It is basketball, soccer, lacrosse, hockey, and then the youth sports are going to be a separate item. And they are saying they'll have some guidance out soon. That should
Got
probably
it.
help because.
yeah, hence is the reason why we called the state, because there is guidance out there that's very difficult to interpret. So, we got it right out of their mouth. So I feel confident that their intention is phase 2.
Okay, got it. Thank you. I apologize for being confused, but that's normal.
No, not at all. I mean, this is a very difficult thing. The guidance is unclear. We're being asked to make Solomon-like decisions with potentially very serious consequences, and it's it's a lot to consider. So again, back to my suggestion is that we effectively make no change until next week, and where we can continually revisit it. But I mean, and to Dr. Jacoby's point, it appears that the state guidance says no tennis. That should be no tennis. So, well, Cheryl, I guess we'll pay them a visit.
Bill, I'd just like to make a comment. Perhaps the guidelines can be placed on the Acton town website, and we could refer people to read the guidance. A lot of these are kind of arbitrary, because you don't know what the risks are, and some of them may even be confounding in some ways. So I do think people need to read the order.
Okay.
Not just like, gee, I like to play tennis. Why does it have to be household members? And again, these are all things they had to draw the line to make the order. So I would encourage having that on the website, and then you can refer them to it.
That would be a very good suggestion. Cheryl, would you mind carrying that forward? I mean, we could just put a link to the states. Yeah. Okay. Well,
I do have a hand raised, Bill. I don't know if you want to take public comment or not.
sure.
Go ahead, please state your name.
I see a tennis ball. I'm going to guess it's Mr. Curley.
It is.
Mr. Curley, your mic's on mute.
Wait a minute. Won't let me unmute him for some reason. Nothing but computer problems today. It's been a very frustrating day with the computer.
I think you put something in the chat. Can you read that?
Oh, yeah, I can. Sorry.
Unless, Mr. Curley, you don't have your mic or computer on mute by any chance, do you?
Yeah, so in chat, he said, tennis on public courts, yes. Where do you see family only? I have not seen family only participation at all, but I cannot unmute him no matter what I'm doing here.
Well, Mr. Curley, then perhaps we can ask Cheryl one more thing to load on her plate, but to send you a link to the state guidance that we're using as a basis for our discussion.
Well, it's on page 7, the phased approach in the document titled Outdoor Recreational Advisory Task Force. It's on their website.
Thank you. All right. Well, I apologize. It looks like we can't hear from Mr. Curley due to technical issues. But Cheryl, does that answer your question at least about other fields?
Yeah, I'm totally fine with that. I agree. I think it'll be an enforcement problem. So, let's start slow with NARA and go from there. And as you said, additional guidance will definitely help us make our decisions.
Okay, thank you. We have one other weighty item, but under the topic of other updates, just very briefly from Mr. Martin, did the Board of Selectmen consider the drive-throughs at your meeting last night?
We did not discuss that at our meeting last night. It wasn't on the agenda before your. I know you guys discussed it on Monday night, but it wasn't. Our agenda had already been posted. In any case, that it will not make this year's town meeting.
Okay. All right. So in that case, Cheryl, do you have any other updates?
No, that's all I have. I think on Wednesday's meeting, I would like to discuss Hazardous Waste Day because it's the end of the month. We need about 3 weeks or so to get postcards printed. So I think we need to make that decision on Wednesday. So if that's okay with you, I'd like to schedule that on the agenda.
Yes, that sounds fine.
Okay, that's all I have.
Okay. So next item on the agenda is something that's come up recently, but Cheryl, would you mind introducing this topic?
Yeah, so we have state guidance that basically says if you get an antibody test and you and the test result gets posted as positive, where the nursing service is required to you know, they're notified by the state that the person is positive. They have to follow up with that person, do the contact tracing, put them on isolation. And we recently had a problem with two people that took the antibody test. Their results showed as positive. The nursing service was notified by the state, and they were called to be put on isolation and do the contact tracing, and they refused. At first, they didn't answer phone calls, so a letter was sent. So we had town council draft a letter that we can use to have the police serve somebody in this case if it happens again. So the letter that I sent late tonight is a letter drafted by town council, and they, you know, the only other option they have is to get a nasal swab. If they get a nasal swab and the nasal swab comes back as negative, they can be taken off of isolation. But again, these two people completely refused. Heather had a bit of a hard time with them. So we're bringing this letter to you tonight to get the letter approved, hopefully. So we can send that letter out if this happens again. And if you need assistance, I think I can grab Heather. So let me know.
Cheryl, mandatory isolation means supervised isolation, like in TB, where you go into a hospital. There are a lot of people that have been isolated at home. That's quite different, because people may not be really self-isolating at home. So I don't think anything should be mandatory in the sense of supervised isolation of individuals at this point.
Maybe mandatory was a bad word I used. I think what I meant to say is, you know, we need to follow the guidance from the state, and the state's directing the nursing service to tell these people to self-isolate.
Yeah, I would change it, because that's not mandatory. Because if they don't agree, what? You're gonna have the police serve what exactly?
If they don't agree, what's that?
If they don't agree to self-isolate, what would the police do?
They would serve them with a Board of Health order, Bill. That's what we're looking at. What's on the screen is the protocol. So this is, you know, if you reach an impasse with someone, they have a positive antibody test, but they refuse to get the PCT test, which can, by the way, be spitting in a tube. It's no longer, that's been approved. Then, and the PCT test would, if that comes back negative, then there is no requirement for isolation, or if they're already isolated, they can be removed. So it appears that these are folks that have got positive antibody tests, but they refuse to get the PCT test. And so consequently, they, under state rules, they must be treated as infectious and follow the infection protocol. They're refusing to follow the isolation protocol. So what we're discussing is preparing or approving a letter, which would be given to the person that gives them a mandatory Board of Health isolation order that can be monitored by the town, and you know, it's enforceable if they choose to ignore the Board of Health order. As the order states, we can get an emergency. I don't know if it's an injunction, but we would petition a court for an emergency order to have the person removed from the house and quarantined at a state hospital. So,
I mean, I think that's excessive in this situation. Someone has an antibody test. Everyone talks about positive tests as if every positive test is terrible and requires follow-up. So the antibody test, I'm not going to argue about all this, but I don't think we should be pushing mandatory isolation to someone who only has an antibody positive test.
Okay. So I'm not advocating necessarily one way or the other. I just point out the state says if you have positive antibodies, I'm sorry?
But I think in the public health, and I've seen this published, is the action should be escalated according to the risk. And you're having someone taken out of their home and put in a mental institution because they're going to be observed for 10 days is rather excessive.
Well, Dr. Bill, I would agree, but there's an easy answer. Go get the PCT, the nasal test. They have ones that read in 15 minutes, right?
Well,
Go get the test. If you're negative, we're done. Go back about your business.
Bill, can I make a suggestion?
Certainly, Mark.
You know, you have other options, and I think it's kind of a stepwise enforcement. You ask them to self-quarantine. I think the next step is that you issue the order, and the next one would be that they would monitor it and check for like surveillance. And then if that isn't appropriate, go get a court order. And the court order could say that they're required to stay at home. It wouldn't necessarily say they'd be removed. So looking at other orders like from the city of Boston regarding this, that they've had in the books for years, you know, it's kind of a stepwise process. I think, you know, the way it's written, I mean, it allows them to issue the order, and it doesn't. I think that is a tool which is probably necessary. And I think if a police officer shows up and says, "Here's the order," I think it kind of goes to the gravity. And there is a recourse before that, Dr. Bill. They can go to court, and they can challenge it, etc. So I think it's an important thing for them to be able to say, "Look, this isn't just an advisory. This is an order. This is important to protect the public health in a public health emergency."
Yeah, and Mark, as I say, just go get the swab.
Well,
Right?
I mean, right. But what happens if you have a situation where that individual is actually extraordinarily exhibiting symptoms and is active in a very situation, and they're saying, "No, I'm going to work, or I'm going out to the grocery store, or I'm going to go to near a park to violate the order, to do some activity." That's, I think, where we're concerned is when that you have a situation where somebody is exhibiting symptoms and can be
Well,
due to transmission.
do we know if this person is exhibiting symptoms?
I don't think we know, Dr. Bill, and it wouldn't, this isn't directed at a particular person. I mean, there obviously are people that are fall in this category, but and I would just point out to Mark's point, you could have people that have positive PCT tests. In other words, the swab tests come back positive and they ignore the isolation orders on that as well. This is a very unique.
That is a different situation.
It is, but the order would be, it's not, we're saying this is a mechanism to enforce the issue, the state requirements in order. And to your point, if the test is inappropriate, it comes back negative, there's a whole bunch of recourses to this, just as there were in tuberculosis, if you can if you can show it's negative, or in other things. So I think what they're saying is they're looking for a mechanism to enforce it and they have appeal rights, or it would be appeal very uncomfortable. But I think, I had some questions about it, but I think it came in very late in where it's a public health emergency and you're looking to have someone to follow the state requirements, and they're looking for an ability to implement that. That seems like a prudent suggestion at this point, and something the board probably needs to act on, or it wouldn't be under the emergency situation.
Yeah, and as I keep coming back to it, I apologize, there's an easy out. You don't have to go to court. You don't have to appeal it. All you have to just show is that you're not infectious,
Okay.
which you can do with a 15-minute PCT test, right? And then everything goes away.
And you also are establishing a bad precedent if you're not going to enforce the order. Then it becomes no longer a public health order. It becomes an advisory, and that
How
would be a
many
big
public
issue.
health orders have we made on the Board of Health?
Very few. In general, I mean, well, you've been on the board quite a while as well, Dr. Bill, but, you know, in general, most people can be persuaded to do the right thing. And, you know, sometimes there's more pushback than others, but in general, you know, most people get there. The only times I can think of where we've had to do it is, well, I don't want to. I think it was a case of a personality disorder, and it was so. In other words, it couldn't be overcome with logic and rational discussion.
Well, there are a lot of those going around today. But
Sometimes,
one thing I would like to say, isolation means you stay in a sick room for 10 days. People bring the food to you, they don't eat with you.
that's right.
Now,
Yes,
at the same time, people that isolate at home, 30% of their household members get sick. That means that all the positive cases were not isolating effectively.
well,
And
maybe.
we don't follow those up. That's just unrealistic in a household where they don't have more than one bathroom or they don't have enough bedrooms. But I think this is excessive force for something. We don't even know if this person has it because the antibody doesn't say that he's contagious.
That's right. It just says at some point they may have had it.
Exactly.
I totally understand, but like I apologize. We're both saying the same thing again and again, Dr. Bill, which is, you know, they have an easy out, and they should avail themselves of the easy out. And
But I can see once it gets involved in this enforcement, the police and the town can get carried away with it.
So when a police officer gives you a traffic ticket, he's carrying a gun. In most cases, he's probably not going to need the gun to enforce a traffic ticket, but you know he has it. And he has it because the situation can escalate, and at some point, you know, he needs to be able to defend himself and enforce the law. I think, and I think this is sort of where Mark was going, is the Board of Health would not choose this as the method of action, and our highly suggested course is to go get a nasal pharyngeal swab, show you don't have active COVID, go about your business.
Right. Let me make I understand you're trying to make an argument by analogy, but I mean, if you made a poll of all 50 states and how they handle a positive antibody, most of them are not isolating positive antibodies. It's a different test than the antigen. Now, someone at DPH decided that would be a careful move, but I want to ask you, are other towns going to be enforcing this to the same degree if someone doesn't want to get the nasopharyngeal swab?
I think Cheryl has motioned, but if you look at the letter from Nina, I think it's Pickering Cook is her last name. She said that this she happened to have one handy because she's already done the same thing for several other towns.
I was just going to say that this has been enacted in many other communities because it is being problematic. And as Bill suggested, you know, this is the state of Massachusetts guidance. It's not guidance from the town of Acton. It's the state of Massachusetts guidance that we're obligated to enforce. And unfortunately, you know, I would say the majority of people are in compliance, but we recently had 2 that weren't, and it was problematic. So we need to be able to have a protocol and in the approved letter by the Board of Health, so we have a little bit more authority, and hopefully they'll read the protocol and they'll read the letter and abide by it. I mean, that's ultimately what we're trying to do. We're trying to get people to abide by this guidance. We're not trying to bring up to a state mandated.
No, I understand. Well, what would the next step be if the person refuses?
So, David, if you can go back up on protocol that you have on the screen right now. So there's steps there, Dr. Bill. It's first you get, let's see, if they're not responding to our calls or texts or not remaining at home, then we hand deliver a letter. And then
Hold
Okay,
on.
we have to be
Are
wearing-
you reading, have you read number 1? In the event that a town identifies a COVID infected or exposed person,
yeah.
this person has a positive antibody test.
Right,
That's
but the
considered
guidance-
infected.
The guidance
That's
from the
an error.
state is
That's
the
an
state's
error.
telling us we have to count them as positive. So until that gets changed, this is the route that the other communities are going. And maybe that will get changed eventually, Dr. Bill. But right now, the protocol is, the guidance from the state is that we have to treat them as positive unless they go get the nasal swab and prove otherwise.
But I do want to go back to all the positive cases. Very few of them have isolated according to isolation conditions.
Well, that's why we still have a pandemic, Dr. Bill. If you
I
look at the
understand.
if you look at the math, we should be out of it by now.
But how are you going to guarantee if he says yeah, okay, I'll isolate at home, go away?
Dr. Bill, you have a valid point, and that is at some point you have to believe that the people will do what they say they will, and sometimes they do and sometimes they don't. But this is a case where you have somebody who's actively saying, I refuse to do what you're asking me to do, not I will and then maybe they don't. They're right at the beginning saying, I refuse, I will not do it. So as a consequence,
No,
you know,
I understand that. Well, I'm not going to oppose it, but I don't want the word mandatory in the minutes or in the agenda, because I think that's a misleading. Mandatory in public health means you're supervised, which usually could be in a prison situation. In tuberculosis, it happens to be because you have to have 6 months of treatment, and the only assurance that you take it all for it to be effective is you get hospitalized at a TB hospital. So I'm not going to oppose it, but I think mandatory is very strong, and I would challenge the state on that.
Bill, I think the point is that the order is mandatory, not that it's a mandatory quarantine. And I think that the wording is a little different.
Maybe so.
Yeah, and you have the emergency COVID isolation order. I think it probably should be isolation quarantine order. It should be both, because you may have both situations
Right.
that arise.
Right.
So I mean, on the title of the document. And just-
I still think once you get into enforcement like this, I'd hate to hear this guy get arrested and spend 10 days in a mental institution as a result of this policy.
I certainly agree, Dr. Bill, although, we're going round and round, but, and just 1 second, Doctor, there are off ramps, many off ramps before we get to this point. Getting a nasal test, agreeing to the isolation order, just saying, okay, fine, I'll do it. All of those are off ramps. The whole thing goes away. And this is just a case of, so use the police officer analogy again of it's like, well, you need to at some point bring into compliance.
That's a good analogy. I would use the prisoner and the prison guard perhaps as a closer analogy here.
No, this one is that everyone can walk away friends. If, it just requires cooperation.
Right, well, I've expressed my point of view. I'm not going to oppose it. But the irony here is I think this is a pretty low risk.
I think you're probably correct. Dr. Jacoby, you were going to add something.
I'm not sure I agree with this. I mean, I think the town has had a history from 1775 of opposing things that the state was trying to do or other governments were trying to do to us. But But I would have a question for Mark. The way it says it, the way it reads in number 4, it says the Board of Health and Town Manager. Does that mean that the Board of Health makes the decision to go ahead with this, and then it has to go to the Supreme Court? Is that how I'm reading it?
I didn't write it. I have questions about it. I read it that town council who wrote it is looking for authorization from the Board of Health and the town manager. The Board of Health, it's my understanding, has independent statutory authority to enforce and to require town council to seek enforcement. But I don't have a problem with the way it's worded with both. But the point, I mean, I would have thought that there are some other things that could be added stepwise. But getting back, I mean, this is a common order in other towns. So I did a quick look, checked like City of Boston. I mean, they've had the order for, I think, almost 20 years. For other ones, it's not something you ever want to do. But there comes a point if you have someone who is exhibiting symptoms, who is
Yes, but
non-compliant, and I think you need to have some mechanism to do it. You need to look at the whole picture. It says you may do this. It doesn't say you have to do this.
right,
When the state says this person is positive, the health department is looking and saying, we're not challenging that. If you challenge it, go medically challenge it and tell us. But in the interim, protect the public health and stay away from others, from the public. And that is either the isolation or quarantine, depending on what the situation is. And we're following the guidance. Unfortunately, the state has dictated that the Board of Health enforce this. And how do you enforce it? You enforce it by requesting someone to do it. If you don't, you issue an order. I think that's really where we're going with this.
Well, Mark, don't go back and say if you have symptoms. Yes, if he has symptoms, that's different. If he has symptoms that's, consistent with COVID-19, he will be determined to be a presumptive case. But if he's asymptomatic and we're pushing this process on, it could get out of our control.
See, what I'm concerned about is you're challenging the state guidelines. You should challenge the state guidelines. You shouldn't challenge the order. The point is the right process.
Yeah, that's fair.
So I think at this point, we need to say, worst case, we have a situation where we need to enforce it in a significant public health situation. And how do we go about it? This is the orderly method. This is what town council suggested we do. It's consistent with other jurisdictions in the Commonwealth and has been used and tried. It's required to be done. So I think it's appropriate. I have some questions and concerns like you do, but where it is a public health emergency, we've been asked to do it at this meeting. It does seem appropriate to do it and to review it. And it's not something which we should take lightly.
But, I agree with what Dr. Jacoby brought up is I don't want the Board of Health then to be out of this process. If we're saying we're going to have a policeman go and enforce this order, I want the Board of Health to be involved in each step. Because I think it's immeasurably stronger enforcement if he's committed to a mental institution for 10 days. Based on the risk, if he has no symptoms and only an antibody positive test, he's not going to spread it. So I'm willing to go along with the consensus of the board on this, but I want to make sure we're involved in every step and we don't just leave it up to the enforcement end of it.
So, Dr. Bill, just along those lines, one of the questions we had was how this would be mechanized. And the way it's set up right now is it would be the board would authorize me to sign a letter, and the letter would be the order, the Board of Health order. And the rationale for that is that, let's say there was a person who had a positive antibody test and they were infectious and they refused isolation. By the time the board could meet and determine whether or not it was appropriate to issue an order, the person would now be symptomatic and probably be, spreading the infection. So when you say Board of Health involved in every step, we would be involved in this protocol and in the order letter, and the board, as represented by me, would be involved in issuing the order. If that's not satisfactory or not what you would, want to see, we could certainly do a process where the board would have to vote for every order letter, but it would introduce a delay that might be counterproductive. So just wanted full disclosure as to what we're looking at tonight. What we're looking at tonight is a delegation letter, or delegation to execute a letter.
Yeah, and execute a case, perhaps.
We remediate a case. We could put a situation where all cases should be immediately notified, all board members, and should be brought to the next meeting. It would certainly be a way to add some
Yeah,
transparency.
I would appreciate that.
Certainly could do notification. Absolutely.
No, I understand the state. However, there are 50 states in the country, and I'm going to try to find out how many of those states isolated people because they had a positive antibody test.
Well,
There's variation, I'm sure. This is a very fine line. So I think if we could arrange to, if he is asymptomatic now, the antibodies develop after an infection, and they can take days to develop. So,
well, or as Dr. Singh said, and I see that actually she's unmuted, so perhaps she wants to add something, or it can be less than days. So in other words, you could still be infectious with a positive antibody test, and I think that is the state's point. So, did you wish to say something, Dr. Singh?
Yes. Has somebody explained the nasopharyngeal test to the individual? Because like the way they show it on the TV, the nurse is putting the long swab right through the nose into the pharynx. So sometimes people get very scared. So has somebody informed the individual that they can go for a sputum test or a saliva test rather than going for nasopharyngeal test to look for the PCR to see viral load if they do have virus in them? And regarding antibodies, sometimes antibodies are generated even if there is just the epitope of the virus. And that's the basis of the vaccine. If you have a dead virus or an epitope of the virus in you, then the antibodies would be generated, right? So if somebody can explain the individual the basis for the antibody test and the basis for the nasopharyngeal or the saliva test, then I think the individual would go for the saliva test at least.
I think that's a good suggestion.
So we, the nursing service did do that.
Okay, so they did explain the other methods for the PCR test.
Yes,
And the individual is still not agreeing for any testing?
correct. It was 2 individuals, but yes.
Do they have any family members with them?
What that I don't know.
Because
And-
if you can
and-
explain.
and-
Sorry.
So yeah, I actually just got an update, but yes, some of them do have family members, and that has all been explained to them, Dr. Singh, and they still are just downright refusing to comply with the state's guidance on this. I mean,
And
go ahead.
do the family members know that they are at risk too if they do not comply?
Yes.
That's strange.
This is, let's just say, extraordinary behavior, meaning not ordinary.
Mhm.
Correct.
And so unfortunately, it's, requiring that we have different methods for trying to get them to do the right thing, which is the goal.
Yeah.
Why don't you just work out something where the person has to wear a transmitting device for 10 days and he can be tracked if he leaves the house?
That's not, I mean, Dr. Bill, we're just following the state guidance. So, and like, until that gets changed, these are the protocols that have been written up. This was submitted to you by town council, but other town councils have also reviewed this, and they're copying this, and there are many communities are using this same procedure, the same protocol that we have in front of you tonight.
Mr. Martin? You're on mute, Dave.
Sorry. Frankly, I think this is a little bit heavy-handed, especially for someone who might be infectious and is definitely not infectious. I'm really surprised that this is written such that this order can take legal action on behalf of the town in this way, and I would note, Bill, you said you would take this action on behalf of the board. That's not what this says. This says the Board of Health shall, not the chair of the Board of Health shall. And so I don't think, and just because some towns have this protocol doesn't mean all towns have this protocol. And so I have a lot of questions here, right? This is a big deal to me.
Okay. No, thank you. Let me just offer you're correct in that the protocol says the Board of Health, but if you look at the letter itself, it only has space for one signature. So
can you pull that up, Mr. Martin? It's another document that was in your packet, the actual letter. I think it says COVID-19. Yeah, that one.
And then there was an email from town council that said it would be a delegation, or it should be a delegation, because of, again, the speed for the infection, spreading the infection.
Sure. I mean, if the board voted and you signed, that's one thing. If you just signed, to me, that's another thing. And if legal action is started on behalf of the town based on just your signature, I think that, frankly, that is wrong. I would oppose that. If you guys vote for this order, I'm going to go question it, right? I can't. I think this is one person can cause the town to enter legal action. I'm very surprised that that's the case. I mean, I have not chatted with town council about this, and I understand that the Board of Health has authorities in these public health situations, but I would like to know what other towns are doing, not just the other towns served by our council, who may have written the same letter. I think this is a big deal. Just my opinion.
No, I thank you, and I mean I agree. It's a big deal. That's why we're having a full and frank discussion. And as we've stated many times, it is not the preferred approach. There are much simpler, more direct, more protective of the public health, and without being as nearly confrontational or escalational as ways to handle the situation. Ultimately, the question comes down to is if you're faced with absolute refusal, do you just then give up, or do you say in a public health emergency that we must protect the public health and we'll do whatever it is required to do that?
Well,
that's a hard decision.
Why don't we have a Zoom interview with this gentleman?
Because they're refusing to talk to us, Dr. Bill.
And we also have patient confidentiality that we have to deal with. I mean, we're just ultimately tonight looking for approval of the isolation order, just so we can have the ability to send this letter to people, not to take them to court. We don't even have the right to send them this letter without board's approval. So we're just, right now, we're really just seeking approval of the letter that was written by town council that we can use if we have somebody that's unwilling to follow verbal requests, you know, and we have to give them this letter. That's all we're really looking for tonight. If you know, if you want to consider amending the protocol at a later date, we can consider that. Just to throw that out there.
Can I make a comment on that? If you're looking at the order, you can issue the order, but you have to, once the order is violated, 3, the health director should notify the Board of Health and the town manager. In that event, the Board of Health shall, with town manager, authorize town council. So it wouldn't be a delegation to do that. So the order would come from the health director, signed by, in this particular case, the chair of the Board of Health. And I think that's, but the point is, that one thing to issue the order is to enforce the order. And so it would have to come back if they do not, once the order is served, if they violate the order, then we would be notified in the Board of Health, and that wouldn't be just the chair. And the town manager would go through the process. And that would mean there would be a public hearing and everything else. But I guess my point to you is, it's a public health emergency. The state has told us that it's a high risk, it's a state of emergency. It's a confirmed problem in the sense that they say there's testing. Now, you can dispute the testing and everything else, but we're just saying it's very clear. Situation, required to implement this by the state guidelines and order and requirements. We issue the order. If it's violated, then you have the other process. So I agree that it's not a perfect order, but there are, it's certainly reviewable, and there are other steps to it. And it certainly has been done in other communities, and I have, to address that, took a quick peek at another jurisdiction I don't think town council represents, an older order, and it has a lot of the same information and for a lot of the same reasons.
How did those orders turn out, you know?
Well, one of them I could think of has been on the books for many years from a very litigious section of the state, and it's still in force. I did not, in a quick look to see whether it's been litigated, but if it's been standing for more than 15 years, I think that it seems that it's stood the test of time. Luckily, we haven't had this situation much. And like you said, we've had very few orders from the board. Usually an order only comes when action is necessary. The goal is compliance, the goal is public health. So I guess we need to provide some mechanism to say, I don't like the test, I challenge the test. There's a different mechanism. And it should be, if you're going to challenge it, it should be, we have a lot of folks that have been home. We've stayed at home for weeks. And we have a lot of folks that are staying away from their businesses. There's a lot of hardship for a lot of folks. But if it's a public health risk, we need to take appropriate action. And that includes making sure that these orders are enforced.
But my caution is, I'm not yet convinced, no matter what the state has done. You know, you've seen what they've done in terms of all the issues about what's permitted and not permitted, and you can play, but within families. I mean, all of this is very arbitrary, just as this is with, if a person is not ill and has an antibody positive test, his mistake was getting that test.
Yes, without also then, as I understand it, most medical providers, such as yourself, Dr. Bill, would, if they ordered an antibody test, would also order a PCR test. Is it PCR or PCT? PCR. PCR at the same time.
No, that's not necessarily true. I mean, the way doctors manage this, it's a brand new condition, and you can get a serology test without having a doctor's order. So, I mean, some people just want to know, have I been exposed? And they get the serology.
And unfortunately, it comes with consequences that they may not be aware of.
I'm sure it does, yeah.
And I suspect that's where we are. And it's,
But it is a very gray line, and it's important that the order and what happens is commensurate with the level of risk that this person has for the community.
so the state, the chief epidemiologist, I think her name is Dr. Katie Brown, has determined that, you know, the risk is high because this person could be infectious and could spread it. They could be a worker at a nursing home and cause, you know, many people to die. And as a consequence, we need to be sure that, in fact, they're not infectious and that a PCR test will do that. And they need to take a PCR test, show they're not infectious, and then, thank you, everyone goes about your business. Otherwise, we have to assume you're infectious until you've completed 14 days of isolation, you know, from the date of the antibody test, and then we can be sure you're not infectious. So, you know, that's the state's determination. They feel it's,
Well, I think we should all take the serology test.
well, I'm willing to do that as long as I take a PCR at the same time, because I want to show I'm negative. And the state explicitly says the PCR trumps any conclusion of the serology test. Right? If that shows you as negative, then you're not infectious. You might have had the disease at some point, but you're not infectious.
But
Go about your business.
and then the next step then is the nursing service will want to be calling this gentleman every day during isolation.
Oh, at least, and that's required.
So
That's what a contact tracer
the
does.
patient doesn't answer.
Uh-huh.
What is the next step?
So, you know, I can just tell you, since I have a close association with a contact tracer, you know, they keep trying. This is, again, an unusual situation. Most people will reluctantly agree to the isolation order. Adherence to it varies, I'm sure, but in general, they understand the need for it. They're not happy about it, but they agree to it. Right? At some point, you may find that they haven't been scrupulously adhering to it, and then you remind them they need to scrupulously adhere to it. This is very unique in that the person, you know, has been told what the state requirement is, told what the necessary measures are, which are not that, I mean, they're burdensome in that they restrict your activities, but, you know, staying at home is presumably not that bad a place to be. And they refuse. No, I won't do it.
Staying in your bedroom and a single bathroom and eating all your, I mean, you know, he should get the test, of course, but I don't think we're going to solve that here. However, I want you to understand this is a very gray area. It's just like saying, well, gee, you can't play catch with someone on the, you know, the public property because they're from a different family. How much does that lead to a threat to the public health? But boundaries are going to be drawn, and I am sure that if someone, you know, runs afoul of this, there'll be regret at the end of the epidemic.
I'm not quite sure. Regret that somebody got infected who didn't need to be.
No. Just, I mean, I'm saying this has an opportunity to escalate, and I would definitely recommend that it's clear that there are simpler, less invasive tests.
I think we need to focus on the order, not the tests. That's not, the issue is, if you have a situation where the state says they must isolate or quarantine, and a person refuses, what is the recourse? The recourse is listed here. And that is to issue the order. And when you get to the merits of it, you can deal with it, but procedurally, you need to deal with it this way. And
I think that is fair.
saying that we're going to challenge it, we question this, is really doing a disservice to our public health responsibility. If the order says we must enforce it, we're not the ones to say medically, we challenge this specific individual's test or state protocol. We can do that in a different form
Has
and
anyone
mechanism.
talked to the state about this?
Oh, yes. Yes, this is, so there's twice a week, because I say like my close association with a contact tracer. Twice a week, there's a call on the Maven system about how to use the Maven system and how to interpret the state's guidelines. And yes, they're getting hammered on it. The state is, as I'll just give you an example. One person got the serology test because they wished to donate blood. They wanted to be able, they hoped they had the antibody so that they could then donate blood to help, critically ill people recover. And they wound up on the list of folks that had to isolate. And they're like, I was just trying to do a service. And so, yes, this has been hammered to the state that they are causing considerable problems, and yet they say the science supports their approach.
I think we need to stop focusing on which test and some of the other specifics. The question is before us. We have a situation where the state says this person has a communicable disease. They refuse to follow the requirements. What does the Board of Health do to enforce it? What they do is they issue the order with the procedural safeguards, and so that's what we're voting on. That's what it's to address. And I think we have to be very specific to what it is. All the other issues are periphery to the legal issue of, if you have a situation, you need to be isolation and quarantine requirements, what does the board do for compliance? And that's, I think, what we need to address.
All right.
And I think we need to be specific, because if we say, oh, we're going to challenge this, we're not going to enforce it, we're not going to do anything else, it's going to lead to a whole bunch of things. So, and we want to make sure, particularly in a public health emergency with a pandemic, that we are clear, consistent, and that the policy is that it will be enforced as it is legally required to be done by the board at this time pursuant to state law. Period.
I think that's fair. Well, but the state's going to have to stand behind it. I don't think the town should have to stand behind this. I mean, I think we can go ahead and do it as our responsibility, but if there's a legal case, as David brought up, who's going to get sued, the town or the state?
And
My guess is the town, because the order is coming from the Board of Health.
So that's fine if we get sued. It's part of the job. That's how disputes are resolved. That is the legal mechanism to do so.
It's not fine if we get sued, right? For someone who might be infectious, it's our escalation to use police officers, court orders, and other things. I think that's an overreaction here. The letter of order may not be an overreaction. Once you get into court orders, police officers, and other things, I think it needs some thought. And also, you guys have taken it, I guess, behind the scenes here to say this is just a decision made just by the chair that's going to get the town into court orders and police officers and other things. I mean, I have nothing against Bill, right? But that is a huge thing here. I'm having a hard time believing it, frankly. And I don't know, pretty tough for me. I mean, I can't say right now because I, from my point of view, I need to do research on this. But it seems like, it's an overreaction. It shouldn't be this way.
Are you saying that it's appropriate that someone that the state says it has a communicable disease should be allowed to defy the state requirements and to provide and to go out and to disobey those requirements and put the community at risk, and the Board of Health should do nothing? Is that what you're saying?
I didn't say that either. I already said.
If we don't enforce it, that's exactly what we're saying. And that's what this order is
Okay,
about.
that's what you're saying, okay? So that's not what I said. The ramifications of the steps you take beyond the letter are important,
Yes.
right? And they need to be carefully considered. And I have a hard time with these.
Can I interrupt? So Bill just called me. He lost his internet connection, so he's going to try to dial in, and he asked Mark to take over until he can get back in.
Okay. Well, I'm going to suggest we try to take as many comments as we can and get public comments, and then hopefully Bill will be able to join us shortly, and maybe we can postpone any type of votes on this until we have a full board, would be my preference. That's acceptable with the other members.
Can I add something?
Yes, go ahead.
Yeah, I wanted to say that what if we write on the letter that we have provided all the options to the individual and the individual is not agreeing to that. And under those circumstances, we are providing this letter to the individual. And in that case, nobody can sue anyone, right?
You can always sue somebody.
But if you have provided all the options, you can have it in writing on the letter that is provided to the individual. Then under those circumstances, the individual cannot say that he or she did not know what options they had.
I think if you look at the emergency order, it says what it does, but at the end, it said failure to comply may result in the issuance of a court order. And I think it has a specific sites, and I think what they're trying to say is, if you comply, that's good. If you don't comply, then you can go to the court order. But I think when you look through the guidance protocol, which I think a lot of us, it has to notify the whole Board of Health and the town manager, and they may seek these things, those who require. And of course, I think it would be better if we had more procedures to this. But with an emergency situation, I think you need to have compliance first, just as you, and then you go through the process and they can appeal it. It's not a situation where you're incarcerating them, but it is certainly a significant impact on their civil liberties.
Well, I feel for the possible minimal risk. I mean, the person ahead of you in line at Donlands could have positive antibodies. I think this is way too extreme, and I don't really care what other towns have done. I think this can only lead to trouble.
Thank you. Other comments?
If we have it in writing that they can go for saliva test instead of nasopharyngeal swab, then like if they still refuse, then we can add that also on the letter so that they cannot say that that was the only option given to them.
Cheryl, you there?
Yeah, I'm here. Sorry. I just feel like by not being able to give somebody a letter who's not complying with the state guidance undermines our authority to protect public health. Until the state changes the guidance, unfortunately, this is the protocol that we have to follow. And I see that you guys all have an issue with the protocols, and I believe that we can possibly amend those at a future date. The letter does have in the last sentence, there's a bit of a threat in that. But honestly, any order letter that the Board of Health writes contains language like that. For example, if someone has a housing violation and we issue the owner of the property an order letter, we have some pretty strong language similar to what you're seeing in this letter here. So I just feel like, we've got to have the ability to protect public health. And I personally think we should have the authority to write this letter. And just another thing to point out, we did reach out to the state epidemiologist today, and she absolutely told us that we have the right to require isolation and quarantine. We absolutely have that right. We're not making this up, so I have a real problem with not being allowed to at least send the letter. And I'm definitely okay with changing the protocols if you guys think that's warranted. We can check with council about adding the language that Rika mentioned. Just in case people are fearful of the nasal swab as she suggested. But we are working really hard. We're following all the guidance by the state. Where Heather's office and is contact tracing. They're spending the majority of their day doing that. So to have some people just blatantly disregard the state really makes it difficult for us. So.
Hi, I'm back, by the way.
All right, thanks, Bill. I think what you missed was a discussion about this, and I think there are obviously a bunch of opinions, and people are very concerned. I guess I'll summarize it by saying the department is very concerned about the ability to enforce the requirements, and without the order going out, they feel that could be a significant hindrance and a public health risk. We have other folks that are obviously very concerned about the authority and where this may lead. So, but we need to mention one more thing, which is Board of Health is required by law to enforce it. So it's not a question of whether we like it, we're required to do so. The question is how. Issuing the order letter is important. It's the step. Now, the protocol Cheryl suggested we review at the next meeting and check with town council about it. I think that's appropriate. I agree with the comments about the whole board with consultation with the town before there is a court proceeding would be advisable and recommended. But I think you need to, because it is an imminent hazard, it is a public health emergency, we do need to issue the orders quickly. They're in an emergency situation. We have to remember we have 140 some odd cases and nearly 36 deaths. This is not a minimal risk. This is a public health emergency in a pandemic. And we can't have folks just say, I don't like to do it. Same thing as speeding or other risky behaviors impact others. So it's very important that it be enforced properly with safeguards and protocols. Bill, it's now your meeting.
Thank you very much, Mark. I see Joanne appears to be prepared to make a comment. Would you care to join the discussion, Joanne?
Sure. I think Cheryl makes a compelling plea and argument for us to at least approve the letter and then to give them the authority and some teeth to have folks comply with the state guidelines and orders. And I also agree that maybe at a later meeting to review the protocols as has been discussed. And I'm torn because I see both sides of it, but ultimately we have a statutory authority to protect the public health. And if there's certain things, if we have to enforce state regulations and orders, then that's what we have to do.
Okay, very good. As just in thinking about it while I was waiting for my computer to recover from its blue screen of death, there's some other, I'll call them, I don't know what you want to say, but perception things we could do. So, for example, it doesn't have to be my signature on the letter. I wouldn't expect it could be Cheryl's signature, if that makes it better, or it could be the entire board signature or a majority of the board signature. We could all sign it if those are more preferable. But I do also take Mark's point, and I believe the town council's point of, there's a need for speed. If these people are truly infectious, and I totally understand Dr. Bill's point that may or may not be true, but let's assume they are, then we need to get them isolated, sooner rather than later. So with that, I guess I would ask, are there other comments, questions, or concerns from members of the board? Dr. Jacoby, you appear to be unmuted. Did you have something you wish to say?
No, I did speak. I spoke while you were gone.
Okay, very good. Then, well, this probably would be a good time to ask, are there any comments from members of the public, Cheryl?
No, I don't see any.
Okay. And Mr. Martin, I know you had, you had, I think, your hand sort of raised as I went blue. Did you get a chance to?
Yeah, I did speak. I completely understand the isolation order. I'm very concerned about sections 2E and 4 of the protocol. To me, it's not acceptable to say, do this now and fix the protocol later. I understand if you want to say that we're not doing the end of the protocol now, I would be very supportive. But the end of this protocol says you're incarcerating the person, right? And the section 4A, the last sentence basically says you're incarcerating them somewhere.
Well, it says may, but yes.
Right, but that's part of this protocol, right?
Mm-hmm.
And I think that the details here are important, right? And what we say is important, and that and what I said before were that this person, you started along this path to do this with no democratic input, not even a majority of the board of health, right? I think that for someone who may be infectious, right? And I'm not dismissing that, right? I'm not dismissing the infectious part, and I understand the letter, and I understand we need mechanisms of enforcement. Sections 2E and 4 are too much for me, and without some investigation on my part. I have to say that these are really big steps, and it endangers the entire town.
Okay. So, if I could just ask, what would your preferred approach be? How would you handle this particular situation?
So, for now, if the Board of Health wanted to order that you send this letter to certain individuals, and actually, I think that this letter, I would have no problem, from me, of Bill, you as a representative of the Board of Health, authorizing that it be sent. So I'm completely okay with that. What I think needs broader discussion is the rest of the protocol. What happens if the person still refuses? And I'm not sure in my mind that this protocol, specifically 2E and section 4, are what I would support. In fact, I'm surprised at the legality of certain pieces here. I won't get into the details, but anyway, that I'm supportive of the letter. the end of the protocol, I have important questions on.
Okay, well, I would just say my assumption or my intention, and I assume the other board members would be aligned with this. Before we took any action under Section 4 or under 2E, we would have, yet another full and frank discussion about moving forward. Like I said, the Section 4 says may, it doesn't say must, and and there's actually choices in there. You can then add the court order on top of the board's order, and then now if they violate the court's order, that's contempt of court, and the court can decide what they wish to do about that. So there's a gradation, I guess, in reaction, but certainly I would think there would be a discussion before we would move to either one of those steps.
I just want to point out, Bill, that up here in 3E, it says the Board of Health must seek an order. In that situation under 2E, not may. And there are other places where it says shall in this document. I think the details here are important, and that's just, maybe that's just me, but I think the details here are important.
Well, no, I agree, but sorry, I read 2E differently than you do, Mr. Martin. It says a board must seek a court order to extend an involuntary isolation and quarantine order beyond 10 days. So in other words, if the board wishes to have a person, if our order is to be quarantined or isolated for more than 10 days, we have to get a court to order that. So in other words, we can't do it on our own.
I understand.
So I hope that relieves a little of your concern.
Yes, okay.
I just wanted to add, human nature is such that if a person has been unruly about cooperating and gets a letter like this, this letter is going to antagonize the recipient.
That's a possibility, Dr. Bell,
Yeah,
or it might
certainly.
have the opposite effect. It's unknowable.
Yeah. Why can't
I would hope.
casual?
Well, if it would help, Cheryl offered to have Heather join the conversation, but I would assume, and Heather has experience in having to use these orders. There have been people that have, for other reasons, have been a danger to themselves or others, and we have had to use these orders.
Think of a protective situation for a person. You have protective orders and situations for domestic abuse and for other things. You issue the order because it's an emergency situation, and then there's a whole appeal process. I think you're right, Bill. On E, it says the board may be rescinded or lifted. So that's a good thing. And you have to, if you can extend it beyond 10 days, you have to get a court order. And I think the last point is what town council probably was saying is the board always has the authority to seek a court order to enforce it. And I think that's actually more helpful than saying we just enforce it. You say you go to court, so it's adjudicated, and they have a hearing to enforce it. And that's an appropriate mechanism, is in all of our legal process. So I have some questions and concerns about the protocol, and I concur that probably doing it on the fly since we just got it is not the greatest situation. But the first part of it says, if you identify it, we're going to hand deliver it. We're going to try to provide it. You have an administrative order, which is specifically called out, and has to notify with a whole bunch of the information. That's a good thing. And it really is, I think, a good process to start with. And honestly, I think it's required by the state requirements right now. So we really need to provide some mechanism. And if town council has drafted the order letter, it seems like that's an appropriate first step. And the second step is to review the protocol at the next meeting, and potentially even have town council explain it, elucidate it, and give us some more guidance.
Thank you, Mark. I was just going to offer that, as I said, Heather, I believe, has experience, not a lot, but some experience with having to use these orders. And, my assumption is that there will be a soft start. Hello, look, this is a public health emergency. Reasonable minds can disagree about the validity, but right now we need to make sure that you don't infect anyone else. There's easy ways to resolve this situation. Let's discuss an easy way. You spit in a tube, and if it comes back negative, everyone goes home. Let's try to resolve it, because if you don't, I have this order in my pocket which I will use, and hopefully that will resolve the situation. And like I say, I believe Heather has some experience doing that, and we'll have to see where it goes. So at this point, I guess I would ask, is there a motion to authorize me to sign up to 2 letters as presented by town council for isolation or quarantine orders?
So I'd make the motion that we authorize the chair or the health director to issue this order, whether it's a situation that's been communicated of non-compliance, and to implement the first couple steps of the protocol, but in all cases immediately notify the Board of Health, and if there's any situation that have an emergency meeting of the Board of Health to review it, and that we add the review of the protocol and information and enforcement oversight at the next regularly scheduled board meeting.
Okay, very good. Is there a second?
I'll second it.
Thank you, Joanne. We have a motion made and seconded. I think we've had a chance to have full discussion, so I'll proceed to a vote. Moving down the line, now that I can see everyone again, Dr. Taylor.
Yes, I'll vote for that motion, to send out the order and also keep the Board of Health involved with an emergency meeting if required.
Thank you. Dr. Jacoby.
I will vote, I vote no. This is too extreme for me.
Very good. Mr. Conaby.
Aye.
Ms. Becerra.
Aye.
And I also vote aye, so motion carries on a 4-1 vote. Okay, thank you all. I know this is very difficult, and I obviously can tell that you've been giving it considerable deliberation, including our representative from the selectmen, and considerable, I'll say judgment and attempting to do the right thing. And it's trying to strike a balance, and it's very difficult to know if that in fact was what we're achieving or not, but hopefully we are. So thank you anyway for your careful consideration. I have one random thought I'd just like to mention. It actually has to do with a previous agenda item, which is that the CDC today came out with guidance for opening and operating beaches and swimming pools. And the guidance is fairly straightforward, but it might be useful, Cheryl, for you to just take a look at it, because I think the question will probably be coming up very soon. And I don't know how that aligns with the state's guidance, but there is at least guidance from the CDC out. As best I can tell, it just came out today.
Okay.
And very simply, by the way, I can summarize it because it's very short. It says you have to wear a mask except when you're swimming. And when you're at the pool or in the pool, you have to maintain 6 feet of separation from everyone else that you don't share a household with. And so that gets, I'm sure, interesting, but that is their guidance. Bizarrely enough, the apartment complex that I'm associated with in New Hampshire must have seen the guidance, and they immediately came out with the same thing, except they added one other thing, which is probably a good idea. Because of the the 6 feet separation, it means you can't have that many people in the pool. They said, we're going to time limit how long people can be in the pool or at the beach so that, one person doesn't monopolize it for the entire day and keep everyone else out. So they said, 1 hour, 2 hours, whatever, but then that's it. You got to give it up so someone else can get in. So just thoughts.
I'd like to make a motion to adjourn.
Well, I could see why you might want to do that, Dr. Bill, but first let me just ask if we've reached the end of the agenda. I believe we actually have minutes still on the agenda.
We do.
So I don't know if Dr. Bill, you'd be willing to hold your agenda until we can address the minutes.
Yes, I'm just not interested in swimming pools, that's all.
I promise you I'm done.
There's one correction that I have to tell you about on the minutes. I incorrectly put the town meeting date is June 25th and it's June 29th. So I've made that correction on my end.
Okay, and there's one more, Cheryl, because I did actually read these. At the end of paragraph 3, I believe you have a hanging sentence. It just stops without concluding. So
Okay.
I think you might be missing a word there. Other than that, I thought they looked fine.
I didn't have my normal week to get them done. So usually I write them and then hold it off a day and then read them again and I can find my own mistakes. But I didn't have the luxury this time. So
No worries.
I will fix that.
But Dr. Bill, since you're in the need for speed, one thing you could do would be to motion to approve the minutes with corrections.
I so move.
Very good. Is there a second?
Second.
Very good. Thank you, Dr. Jacoby. We have a motion made and seconded to approve the minutes of May 18 with corrections. All those in favor, and let's go from the bottom up. Ms. Becerra.
Aye.
Mr. Conaby.
Aye.
Dr. Taylor.
Aye.
Dr. Jacoby.
Aye.
And I also vote aye. The minutes are approved. Thank you. I believe we have now reached the end of tonight's agenda. Is that true, Cheryl?
We have.
The floor is yours, Dr. Taylor.
Yes, I make a motion to adjourn.
Second.
A very weary Mr. Conaby has seconded your motion. All those in favor, let's do this by voice vote. Please say aye.
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 Any opposed? Okay, we stand adjourned. Again, thank you all. This is, it's very difficult to be a member of the Board of Health during a pandemic. And it requires us to do things that are kind of out of our normal swim lanes. And I very much appreciate everyone stepping up and really giving it your full attention and your obviously considered thought. And you all bring different expertises. We heard from everyone tonight. And I think that's really great. I really want to say I'm very, very proud to be associated with this board. So thank you all.
Oh, shucks. Thank you too.
Yeah. Well,
We are very appreciative of your leadership.
Bill, get your computer fixed.
All right. Well, thank you all. So next meeting is a week from tonight, unless something comes up. So thank you all and good night.
Good night.
Night.
Good night.